The U.S. is officially leading the world monkeypox race, not in the fight against it, but in the number of infections since the global outbreak began. More than 3,800 cases have been reported, according to the CDC, including more than 80 in Massachusetts. And increasingly, the Biden administration is under pressure to do more to contain the spread. Rhode Island Congressman David Cicilline has requested $100 million to implement a federal response effort to the virus. And Biden is considering declaring a national health emergency following the World Health Organization's declaration of a public health emergency on Saturday. Well, that sounds familiar, right? But we get ahead of this outbreak before we experience deja vu all over again. I'm joined by Dr. Phyllis Kanki, a professor of immunology and infectious diseases at the Harvard T.H. Chan School of Public Health. I'm having a hard time saying it, and it seems like, Dr. Kanki, we all are having a hard time dealing with how we're dealing with a new infectious disease, or at least new outbreak. Should we do a do-over here? Should we just say, starting today, let's figure out how to deal with monkeypox the right way?
I think we're slowly making the right decisions. And I think that it's just that this virus, which we've known about, is behaving a little differently than it has in the past. And so I think that's thrown many of the public health officials for a loop. But we do have the experience from COVID, so that's helping us move, I think, quickly with the different policies and stocking up of vaccines, et cetera.
When you say it's behaving differently, is it behaving differently because it's, I don't want to say spreading fast, but spreading on more continents than it has before? Or is there actually something different about the virus?
Right now, they don't think there's anything different about the virus based on the sequence that they've made. But what we've seen in Europe and in the US, that it's definitely spreading more rapidly than it has in the past. And it's spreading in groups that we hadn't seen before. So those two latter behavioral traits makes it unusual.
Let's talk about what happens if you catch monkeypox. I've heard a couple of folks have said to me, I'm not that worried about it, you can't die from it. I've had other people say, the last thing I want to do is deal with a painful rash. I'm more concerned about that than I am about COVID right now. I would argue you should be concerned about both things the same level. But what's it like to get monkeypox, and how concerned should you be if you have it?
I think it's pretty variable. Overall, it's certainly not on the scale of COVID, but there are cases that the lesions are extremely painful and people have had to be hospitalized. And then there are cases that are quite mild. So overall, it's a more mild disease, and people shouldn't be as worried about it as they are with COVID. But I do think that for some individuals, it will be quite a painful course.
Yeah, I had the chickenpox when I was 22, and that was not a pleasant experience. So I'm anything with pox in it, I'm going to pay attention to. Let's talk about the messaging you alluded to a little bit. Hey, the good news is that it seems that experts are concerned about making sure they don't target certain groups. I know in the news media we were concerned about what images we were showing early on, since some of the original infections were not in Africa, and we were showing many images of people in Africa because that's the images that we had for stock photos. So there's been some awareness around that. But there seems to have been a few missteps in trying to communicate clearly, especially to the gay community, many of whom have been infected, not necessarily through sex, but maybe just body-to-body contact. This is a disease that you can catch from someone's clothes, you can catch from touching someone's skin. Is there a better way to communicate to risk groups right now around monkeypox?
I think that's still challenging, because I think what we're seeing is that the virus is moving in networks that happen to be men who have sex with men. It may not be always transmitted by sex, but more the close contact. And we know that this virus is pretty easily spread through lots of mechanisms. I mean, even in clothing and even in prolonged contact into respiratory secretions. So I don't think we want to target particular groups, but we do recognize that there are certain populations at the moment who are transmitting the virus, and that's where we're seeing the majority of the cases.
One of the challenges we seem to be repeating, as we did with COVID, is the access to vaccines and the access to testing. I know here in Massachusetts, a number of sites have opened up for vaccines that are, and there's been outreach done to communities to make sure that they know that they can get it. Do we need to do more on that front? Do we need to really make sure that we've got the vaccines and the testing available as we do the messaging?
I think the administration is moving quickly on this, even in the last few weeks, because early on when the vaccine clinics opened up in some of the high impact areas of the country, they ran out quickly. So they're beginning to stock up, and I think FDA and many of the other agencies are moving quickly to make sure we manufacture the stockpiles of vaccine that we need. But I do believe that we're ahead of where we were with COVID. We have vaccines that work and that can be given to individuals even after they're infected.
Is it seems the pause in travel and the stay-at-home orders that we experienced during the beginning of the COVID pandemic made us forget how close we all are when it comes to travel. That you could, go to a party in Europe and then come home and just with an encounter or interaction with a handful of people can spread a disease worldwide in a matter of weeks. Are there things that we should be more concerned about in terms of how easily worldwide outbreaks can become, or do you think this is just an anomaly?
I don't think it's an anomaly. I think we have COVID and now we have monkeypox right after that, and we're seeing both of those agents move with unbelievable speed. So I do think it gives us some pause to think about the perspective of how closely we live with our global partners and how new pathogens can really move quickly around the world.
I know a number of experts are looking at treatment of post-COVID, especially around fatigue and other illnesses, and the number of folks who have been infected with COVID and are experiencing long-haul COVID or fatigue, which are not necessarily, from my layman's understanding, unique to just COVID. Any virus, Epstein-Barr, can cause long-term fatigue. I heard one expert say that COVID is just a virus being a virus. Is there some opportunity here and to really find ways to help treat people who have had fatigue and long-term virus, post-viral issues? Are we at a breakthrough moment, do you think, because of, obviously not a price we want to pay, what we've been through, but in order to help bring some new treatments to folks with these long-term issues?
I think treatment will be the goal. I think what long COVID has taught us is that we need to continue to do more research on it. And I do think that COVID is distinct because there's a larger proportion of people who get the disease who get long COVID. So with other viruses, you'll have a much smaller fraction of people who will suffer those long-term consequences. And as a result of those smaller numbers, there's less emphasis and less research that continues on to try to find better treatments for those long-term consequences.
So shouting back a little bit to your earlier comment about all of our neighbors living so closely together and traveling so quickly and being able to circle the world, so many people opportunity for travel. What do we need to do here in Massachusetts or in the United States to really buck up our healthcare systems and our messaging so that it doesn't seem we're inventing the wheel every time we come upon a virus, that we don't need to wait to get to the World Health Organization declaring an emergency for us to be able to get the treatment and the access and the information to the people who need it the most quickly?
Well, my personal view is that the U.S., particularly under COVID, suffered because we didn't have a more nationalized healthcare system, and we saw how some countries who had those kinds of organizations and infrastructure were able to move more quickly. The UK is an example, but I've even seen countries in Africa that had better reporting just because they have a national system. And we put a huge burden on all of our states and their public health departments to be able to deal with a new pathogen that they had never seen before. And I think that's something that I think we can nationalize some of those activities for surveillance and diagnosis and reporting, et cetera.
So we're all getting ready to get back to school. The stuff is already out in the aisles. The index cards are ready to go. Folks are getting back to work, many. As we get ready to get to fall and get back into the buildings, do you have any quick, top 3 bits of advice that we should all be keeping in mind to keep ourselves safe just in general, not just for monkeypox and COVID, but how can we do this in a healthy way as we close here?
I hope that employers will and universities, et cetera, will really think about their policies depending on what's going on come the end of August and September. And as is always the case, if you don't feel well, you should stay home.
That's always good advice, I think, right? All right,
Right.
Dr. Phyllis Kanki, thank you so much for joining us and helping us navigate through this. I appreciate your expertise. Thank you so much.